Hello, my name is Tamika Gutierrez, and I'll be going over sexual coercion, which is chapter 18 in our textbook. I'll be going over not the whole chapter, but a brief summary of the learning objectives. We're going to talk about rape, we're going to talk about types of rape, we're going to talk about the psychological characteristics of a rapist, and we're also going to discuss the adjustment of a rape survivors and sexual abuse when it comes to children. Rape is a sexual activity that takes place without consent. There's three forms of rape: forcible rape, statutory rape, and sexual assault. The psychological characteristics of a rapist. Who are they? Well, there isn't really a psychological characteristics for rapists. They don't have like a certain look or a certain way that actually a rapist looks. Many of them do have certain personality traits, which could be antisocial or aggressive. And the reason behind them being aggressive is they could, one, have a peer group that is pressuring them into having sexual activities, or it could just be a social dominance thing where you just want to be in charge of a woman and that's how you prove it. The adjustments of a rape survivor. Usually, since this event is so tragic in one's life, it's a big crisis, and it involves being shocked, and a loss of self-esteem could take place, which can last from anywhere from weeks to years. The reason why sometimes sexual assault victims do not report it is because they feel fearful or the social stigma and concerned about what others may think of them. The rape survivors could also suffer from psychological disorders such as post-traumatic stress, also known as PTSD, which is a stressful disorder of a traumatic event that could happen in your life. And whenever it flashes back, it could cause you to have disturbing dreams or intrusive recollections of the thoughts. Women often blame themselves, and if they do, most of the time they suffer more from severe depression. If you are raped, don't change anything about yourself first thing first. Seek help. Trust someone that you can tell. Ask a family member or friend to take you to the hospital. Call any of the rape hotlines to get yourself some help. Rape prevention, elimination of a rape will require changes in attitudes, and education on rape and knowing the signs to look for and the precautions is also a good preventative method when it comes to rape. Sexually abused children, most of them are girls, which is 200 to 300,000 yearly. About 8% of boys and 20% of girls are sexually abused worldwide. And it usually occurs over the internet with images or any type of invitation to chat rooms. The patterns of abuse. Boys are most likely to experience sexual abuse from 7 to 10 years of age, and girls on an average of 6 to 10 years of age. Critical thinking question. Why do you think that most cases of child sexual abuse are not reported to the authorities? If you go back to my last slide, the answer is right here. Children rarely report due to fear of retaliation or blame. Most of the time, family members are not trying to hear if their child's abused, especially if it's someone that's close to the family, because they don't want to ruin their reputation. There's different types of abusers. There's male abusers, which are most likely they've been abused themselves, and female abusers be more common than previous thought. Most are males. The effects on sexual abuse on children. Abused children commonly act out. That's the one that stands out to me the most because I know that working with children, I've seen this take place before. So many show signs of aggression and antisocial behavior. If you want to prevent sexual abuse in children, just help children understand what sexual abuse is and teach them to speak with an adult or someone that they can trust if sexual abuse do take place. Okay, the last critical thinking of the day. Do you think that we should punish sex offenders and not worry about treating them? The answer to that question is, I think that we should punish them and also treat them, because if they get the treatment, if for whatever reason they get a sentence that may not be that long, that can help them like when they get out. So I really think that we should do both. Treating them is very important because we have to get down to the psychological issue. But that concludes my presentation. I hope you enjoyed it, and that's it.